In just about every part of our lives, everything is connected. Your maps talk to your calendar, your messages sync up everywhere. It's all one seamless, intelligent network that's built around you. So it kind of makes you wonder, right? What if our healthcare worked the same way? What if it was just as smart, just as connected, and just as focused on you?
I mean, really think about this for a second. What if your doctor knew you were getting sick before you did? Now, that might sound like something out of a sci-fi movie, but it's actually the core promise of a huge idea called connected health. Today, we're going to break down exactly what it is, what it could mean for all of us, and yeah, what's really standing in the way. All right, let's get into it. So first things first, what are we even talking about when we say connected health? To really get to the bottom of this, we're pulling our insights from an expert workshop that was published in the Journal of Medical Internet Research. This is where a bunch of leaders in the field got together to basically draw a map of this new frontier. At its most basic level, connected health is all about creating a logical link between all the different pieces of your health journey. Think of it like a network that connects your smartwatch, your electronic medical records, your doctor's tools, and even your pharmacy, making them all talk to each other and work together as one smart system. The goal here is simple, but it's also absolutely profound. Better health for you and a way more efficient system for everybody.
Okay, so now let's talk about the dream scenario. If we actually get this right, what does that future look like? Well, the experts pinpointed several key pillars that could build a healthcare system that is truly revolutionary.
They laid out these 6 big opportunities, and it's all about making data easy to actually use, helping doctors and patients work together better, and, building the digital highways that all this information needs to travel on. Now, all of these are absolutely critical, but the experts really zeroed in on one in particular: user-centered design. Why? Because it's the foundation that all the others are built on.
And this concept right here is the secret sauce. Instead of some tech company building a gadget in a lab and then just handing it off to doctors and patients, this whole process flips that script. It says, nope, start with the actual users. Talk to them from day one. Build a rough draft, let them play with it, test it out, and then just keep refining it over and over. It sounds so simple, but it's absolutely essential for making sure these amazing tools are actually useful in the real world.
So here's the bottom line. The dream of connected health isn't really about the fancy gadgets. It's about building a system that is fundamentally smarter, way more collaborative, and designed to actually last. A system that works for us, not the other way around.
Of course, that's the dream. But like with any giant leap forward, there's also the reality. And the experts were super clear that while the vision is exciting, there are some huge real-world hurdles that we have to get over first. So what is it? What's really stopping us from getting to this connected future? Well, it turns out the problems aren't just about technology. They're deeply human, and they're baked into the systems we already have.
The workshop boiled it down to these 5 core challenges. We're talking about getting different computer systems to actually talk to each other, navigating a complete maze of ethics and regulations, making sure the data is even right in the first place, setting clear standards, and maybe the toughest one of all, getting all the different people involved to work together. Let's dig into a couple of the biggest ones.
Let's start with a big one: interoperability. It's a mouthful, but here's what it means. Imagine you walk into an emergency room, and the doctor can't see your medical history from your family doctor because their systems just don't speak the same language. That's the problem of siloed systems. Your data is literally trapped. A connected system lets that info flow instantly. But, and this is a huge but, what happens if the data that gets shared is wrong? That brings up that other challenge: data quality and trust. If a doctor can't be 100% sure your allergy information is correct and up to date, that fancy connected system suddenly becomes a huge risk, not a help.
And then you have the ethical minefield. This goes way beyond just following the letter of the law, like HIPAA. It's about asking some really fundamental questions, like who actually owns your health data? How is it being used? And this is a big one. As we start to lean more on AI, how do we make absolutely sure that the data we use to train these algorithms isn't biased? Because if it is, that could lead to worse care for entire groups of people.
This really gets to the guiding principle that the expert said has to be at the very heart of all of this. Nothing about me without me. It's such a powerful and simple phrase. It means that the patient, you, has to be at the absolute center of the conversation. You should always know what data is being collected and exactly how it's being used. No exceptions.
And finally, you've got the stakeholder puzzle. Just think of connected health as this really complex machine with a ton of moving gears. For it to actually work smoothly, the patients, the doctors, the hospital administrators, the tech people, and the government regulators all have to be turning in sync. This is also where those standards come in. Without some agreed-upon rules for how to design and evaluate these tools, every hospital is just building its own little part of the machine, hoping it'll fit with everybody else's. And if just one of those groups is left out, the whole thing can just grind to a halt.
Okay, so we have the dream, and we have the very real challenges. It might seem a little overwhelming, but here's the good news. The experts didn't just point out all the problems. They also gave us a blueprint for how to move forward.
And here it is. This is the game plan. It's about adopting universal standards like FHIR, which is basically a common language for health data, so all the different systems can finally talk to each other. It's about building those ethical rules right into the tech from the very beginning, not just tacking them on later. And it's about using that co-design process we mentioned to bring everyone to the table, making sure we're building systems that are actually built to last.
So if there is one thing to take away from all of this, it's this. The technology is only half the battle. We can have the most advanced sensors in the world and the smartest AI, but none of it means anything if it isn't designed for and with the very people it's supposed to help. That human-centered design, that's the real key.
Which really just leaves us with one last massive question. The technology to build this future, for the most part, it's already here. We have the tools. The real question is, are we, as a society of patients, doctors, and policymakers, are we ready to do the hard, collaborative, and human-focused work to actually make it a reality?